Carcinoma is the most common form of liver cancer all over the world. Unfortunately, it's also a tumor whose rates are increasing in the U.S. As you can see here, the dark line is the total population. The puzzling thing about HCC in the United States, however, has been that there's a perception that the majority of it is not associated with known risk factors. So my colleagues and I wondered about the accuracy of this perception and decided we would take a look at a nationally available database to see if we could verify it. The risk factors that we looked at in this database included the ones shown on this slide: chronic infection with a hepatitis C virus, or HCV, chronic infection with a hepatitis B virus, or HBV, alcohol-related liver damage, and of course this involves excessive alcohol consumption to get to liver damage, certain rare metabolic inherited disorders. These are things like hemochromatosis, alpha-1 antitrypsin deficiency, glycogen storage diseases, rather rare in the population. We also included two related conditions that more recently have been associated with HCC in studies. These are diabetes and obesity. To do our study, we used the large SEER Medicare linked databases. This is a program that links cancer diagnosis in the SEER cancer registries around the country with medical diagnoses in the Medicare population. What we found was the following. Our first step was to determine the risk associated with each risk factor in this population. So if you take a look at this, the interpretation here is that an individual who is infected with the hepatitis C virus has a 40-fold greater risk than a person who is not infected. The comparable risk associated with hepatitis B virus was a 13-fold increased risk. Individuals who had alcohol-related disease were at a 4.5-fold increased risk. Those with rare metabolic disorders at a 3.5-fold increased risk. Individuals with diabetes at almost a 2.5-fold increased risk. And finally, individuals who had a diagnosis of obesity at a 1.5-fold increased risk. And all of these risks were statistically significant. These risks really aren't surprising. There have been ones that have been reported by a number of studies. Though not surprising, I should say, they tend to be misinterpreted as being an indication of the importance of risk factor in the population. This is really not an accurate understanding because they give you no information on the prevalence of the risk factor. So what we did next was to calculate the population attributable risk of each factor. And as you can see, the order of risk factor changes considerably when you do that. The risk factor that seemed to be associated with the greatest number of HCCs was diabetes. It was associated with a third of HCC in this population. The second most common risk factor was alcohol-related disease, associated with almost a fourth of the risk of HCC. The other risk factors in order were hepatitis C virus, associated with about 20%, hepatitis B virus with about 5%, then the rare metabolic disorders and obesity each with about 3% of HCC. So we also wanted to determine whether these risk factors explain the same proportion by various racial ethnic groups and by gender. Whoops, excuse me. Let's see if I go over here to next. And we found that, in fact, the risk factors jointly explain the largest proportion of HCC among Asians in the population, at about 68%. Unfortunately, they did the poorest job of explaining HCC among African Americans. There, it's only about 50%. They do a little bit better job in males than in females, although those percentages are not radically different at 64 versus 60%. But overall in the population, they explain about 63% of tumors, which is a little bit different than the former perception. We really can explain now about 2/3 of HCC in the U.S. Unfortunately, that leaves us with the realization that we still have a ways to go here because we have 1/3 of tumors that aren't explained by these risk factors.